Good afternoon, everybody. Back with Josh and Paul. Deirdre Gifford here, Department of Social Services. I think nursing homes may come up. Got the report back. Miguel Cardona, Commissioner of Education. We got 2 weeks till schools are opening. There may be some questions there as well. I hope you got a little break this August, or maybe you still have some vacation coming. We had a short break, which I really appreciate. Although the COVID daily numbers seem to come up even at our dinner table on rare occasion. We're generally more fun than that, but I owe you an update. And the numbers are still pretty good. I think we should sort of more start focusing on the 7-day moving averages, but I just wanted you to know that the average for today is still less than 1%, incredibly which is positive news. The 7-day moving average, I think, is 0.8%, so less than 1%. Again, Connecticut's a leader there, for which I thank each and every one of you. 1 fatality, 2 fewer hospitalizations, 12,000 tests. We've done about 87,000 tests in the last week, so the tests are going along, and it does make a difference. We'll show in a minute. And I think you saw reported yesterday, we've now performed over 1 million tests, which I think makes us number 2 per capita in the country in terms of the amount. We're top 10 in terms of per capita, number 2 in terms of other metrics. And the testing is important. I can explain in 1 minute. The next chart is reflective of the fact that based upon our infection rate, we're doing a lot of testing. Second only to New York. That's really important, in part because we have a very low positivity rate. We're able to track and trace. Because we can track and trace, we can contain the virus, and that's making our good news continue now for moving into a 3rd month. Our testing is done in partnership between the state and our academic partners, private in-state labs. The private in-state labs is really important. Josh helped take the lead with this, working with the controller's office, working with local labs. That means our median testing time in 1 day, get those tests back over half. 75% of all of our tests we get back in 2 days. That is so key. You've heard about the delays going on around the country, send the test results across to California. It takes 7 days to come back. In part, that's what happened early on during this pandemic. By the time we got our test results back, you could have a nursing home that was highly infected. We're in much better shape on that front. And I think you'll see on this chart, it's sort of interesting, all the states that have more or less got the pandemic more under control are those that are near the top of the list, according to the New York Times, in terms of testing compared to where we ought to be. I will say that we've got our COVID relief fund, the CARES Act, and we're devoting probably a higher percentage of our monies to more testing than just about any other state in the country, and I think it's having a positive return. Why don't I just keep going if you want, Max? Is that okay?
Folks won't be able to see the PowerPoint. Thought we'd fix this. Hold on.
If we're back on, guys, let's go to the safe schools reopening on track. As you know, we're a couple of weeks away in terms of opening our schools. I said we're only going to do that based upon really tight metrics that come out of a number of our university institutions here in the state and beyond. And these are the same metrics that other states are following as well. Probably the most important of those metrics in terms of whether we can reopen our schools and how we reopen them safely is the 7-day average per 100,000 population. I think you can see from Fairfield down to Windham what that variable is. We have said that 10 per 100,000 is the number that would be a break point where we maybe would have to adjust how we reopen schools. Right now, 3.3 is the highest, so we're way below those metrics, which implies to us that you can open our schools more safely. Fairfield County is the highest at 3.3. That's in part due to a small flare-up in Danbury. So what Josh is doing there is bringing in the reinforcements, bringing in additional testing to the Danbury community so we can identify folks who maybe are carriers and track and trace and hold that down. Tolland is the champion, you see, in terms of 0.8 out of 100,000. The other tests are sort of secondary indications we've talked about before. The percent positivity is the one I always lead off with every day. And I think you can probably take a look and see where your county is in terms of that metric. Let me go to the next chart now. As you know, going back a month or so, we got Mathematica, which is a leading consulting agency that focuses on a nursing home industry, to take a look at Connecticut nursing homes, our response to the COVID crisis. We were hit hard in our nursing homes, as you know, as were all of our peers, the other 49 states. And we wanted to do everything we could to see what we could learn from what was going on in March and April. And if there is a flare-up in October, November, we want to be ready and make sure that we've learned those lessons and are better prepared. I think there were no great surprises that came out of this. It reinforced, though, validated a lot of what we were doing already in terms of A, making sure we have a stockpile of PPE, B, making sure we're in there testing and testing aggressively going forward. And these are things that we're doing now, and I think that was reinforced by the Mathematica analysis that we got. And that's an important piece going forward. It's, you know, they did bring out that the data systems are antiquated in this state and others. And early on, we were getting a lot of our reports in fax form. I haven't seen a fax in 20 years myself, but we are still using them here and using them in other states around the country. That has been rectified. We're getting real-time information. As I showed you in the chart before, in terms of how important it is that we get our tests back in almost real time, say a day, 2 days worse. You know, back then, in March and April, we were getting the tests back sometimes a week later. That was reinforced in the study, how important the testing is, how important we get that response back quickly. Let's see, I'll move to the next chart if I could. This was sort of interesting. Look, we were hit hard by fatalities in nursing homes and retirement communities, and so are our peer states. This is just an example, Massachusetts, New Jersey, and Rhode Island, since they quantify fatalities, COVID-related fatalities, the same way that Connecticut does. And again, you can see that, sadly, we all suffered from some of those same problems in the nursing homes, which we're now, I think, much better positioned to take care of. We've got our stockpile, we're doing our testing. The other report they had was just, we've got to look into the difference between for-profit and not-for-profit nursing homes, those who are part of chains, not part of chains. I think this is just an interim report, so we are going to get better information over the next month or so. A small sidelight to me is I think you're going to find that Connecticut has more nursing home beds per capita than most other states as well, and that skews the number a little bit, the type of thing we're thinking about going forward. This next chart, we're jumping around a little bit, but it just reinforces the importance of mass, where Connecticut has been a leader, and it makes an enormous difference. And this was you know, the antibody testing from all the frontline workers, those nurses going into the ICU at the very height of the pandemic, when you had a 20–30% infection rate. And here we have, in hindsight, the Hartford healthcare employees contracted COVID-19 at about the same rate as the general population, and the study says. And that's evidence that the protective gear, starting with the face mask, stopped the spread of the virus. I think that's just an important reminder of what was going on. It's also an important reminder, Miguel, as we get our schools back, importance of wearing the mask, how that protects our teachers, how that protects our students. With that, Max, again, we got Deirdre and Miguel here and our team, and happy to take your questions. It's been a while.
Channel 3 Eyewitness News. Channel 3 Eyewitness News. NBC Connecticut.
Good afternoon, Governor. What can you tell us about the situation at the Three Rivers Nursing Home in Norwich?
They've got, 11 plus infections there. We tested aggressively over the last couple of months. We're able to detect those infections early. I think you're going to find of the 200 other nursing homes around the country, around the state, there's a total of 4 infections. That said, we're taking a hard look at Norwich. What happened there? How did that infection get into Norwich? And hopefully we detected that early enough when we get the people quarantined. Deirdre, anything you want to add on that?
Yes, thank you, Governor, and good afternoon, everyone. So the Department of Public Health has been on site at the facility. We have been looking at all of their infection control practices, the process that they've been using to cohort or put together individuals with the same infection status. That's important. We're making sure they're doing that correctly. We've been looking at their compliance with the governor's executive order regarding mandatory staff testing to make sure that they were doing that. And we've been looking at all of their infection control practices in that facility, including staff screening. So when our inspections are complete, if there are any findings, those will be public. And if it's merited, there will be citations or fines for the facility.
Commissioner, how long will it take to get that report in? Is there any indication that the nursing home is not taking proper protocols? And also the union was saying that the nursing home is understaffed, they lack PPE, that the state needs to send people to the nursing home to help care for residents.
So we have been on site, as I said. We're one of the things we've been looking at in terms of their infection control practice is their level of staffing. So that will be taken into consideration. When we find serious concerns in any facility, not just this one, we require the facility to produce a plan of correction for that serious infraction or violation before we leave the facility. So to the extent that there were findings that needed addressing immediately, a DPH would have ensured that those things were in place prior to leaving the facility.
And Governor, regarding schools, how are they looking in terms of funding, PPE plans? Do you feel like districts are ready, in your opinion, to open soon?
Different levels of preparedness, but Miguel got the guidelines out now a couple months ago. We got the response back. They know we've got the Connecticut funding in place. The state will provide them everything they need in terms of public health, starting with the PPE, starting with the disinfectant, doing everything we can to make sure those schools can open safely. And I think you're going to find there's a mixed group as they open. Some are going to open full-time initially. Some will take maybe 2 or 3 weeks, and then they'll open full-time as they get their feet under them. And some will probably stay hybrid a little bit longer. Miguel, anything you want to add to that?
Yes, thank you, Governor. Good afternoon, everyone. Glad to be here with you. Districts are preparing, and a lot of work is going on to make sure that all the details are being communicated. As I speak now, there's a team from the State Department of Education meeting with the district on their reopening planning and making sure all the details are being looked into. And we also have another a webinar going on with health information being shared to districts in partnership with DPA. So a lot of work is happening to make sure that districts are ready.
Thank you.
Fox 61.
Hi, Governor. Is there any update on when phase 3 of reopening may begin?
Well, for me, the schools and the colleges is a big part of the next reopening. The rest of phase 3 would be upping the occupancy in restaurants and in bars. And obviously, we're going to have to take a look at that as the weather gets colder, starting next month, but no plans at this point.
And then the $400 additional unemployment benefit authorized by the president, what's the status on when residents could see that money in their pockets, and how is Connecticut going to fund its 25% of the cost?
Well, at this point, you probably saw the feds have given us some guidance where our contribution that we're already doing counts as our 25%, so there won't be any additional cost to the state of Connecticut. That said, there will be a $300 true-up under the current plans under the president's executive order, and I can tell you our Department of Labor is going to be filing for that very soon. Paul, anything to add on that?
Yeah, I think the other thing to add, I know based upon your question, you're probably commenting on the fact that other states have put forth applications, but I just also want to let you know that while the federal government is still coming up with their distribution plan in terms of their technology to get out to states, no state has received any dollars, even those who have already received authorization and put forth their application. As the governor stated, the State Department of Labor has been working with the U.S. Department of Labor to get all the information to provide a recommendation to the governor, and the governor has provided final answer to Department of Labor to go ahead and put forth an application and to get those fundings to the state of Connecticut.
News 8.
Governor and Deirdre, back to the preliminary assessment from Mathematica. One of the things they said was that there was no plan in place with regard to nursing homes. Your reaction to that, and do you agree with that?
Well, I'll start with this. I mean, when you say no plan for a COVID pandemic, the likes of which this country hasn't seen in 100 years, you're right. We hadn't planned every step of the way. But I think we reacted very quickly. We reacted in terms of, limiting the folks who can go into the nursing home, reacted in terms of finding what we could in terms of the PPE, doing the testing quickly, but we couldn't test everybody. You maybe remember early on, our public lab couldn't do more than 20 or 30 tests a day, and that included hospitals and everybody else. So we had to ramp up quickly, and obviously the quicker you could have ramped up, the better it was.
And from Deirdre?
Deirdre?
So I'm actually not quite certain which of their findings or recommendations you're referring to. They did talk about some general issues that were in place in Connecticut as they were around the country. So we did not have, as the governor just referenced, an abundance of testing at the beginning of this pandemic. We did not have an abundance of personal protective equipment in all cases. Both of those conditions were the same around the country. Connecticut was certainly impacted, as were our nursing homes. So there were some of those conditions in place, but I think the general findings from the report indicated that Connecticut did take actions that followed the science and the public health recommendations that were coming out of CDC, and that we adapted as we learned about the behavior of the virus and the way that it spread in nursing facilities.
And Governor, unemployment obviously still very high. The DMVs are open. The state has maintained a low transmission rate, as you talked about. But why not the Department of Labor and opening up job centers?
Look, we got to get those open as soon as we can. What you probably know is we had to work really hard to get all the unemployment checks out. So we redeployed a number of people over to DOL, the Department of Labor, to accelerate what we had to do there. Many of the job site things can be done online, but we're going to get those open as soon as we can. Obviously they required a lot of personal contact, so they were not the first things we opened up. we're ready to move on that now.
The Associated Press.
Thank you. Good afternoon, everyone. Governor, what has been happening lately with the multi-state partnership with New York and New Jersey? Are we still meeting with them, and what are we still coordinating on?
We certainly talk informally a fair amount. In terms of formal coordination, I think maybe we've taken a pause on that right now. We had looked in terms of doing some purchasing together, and perhaps that's still going on at the purchasing level. We're comparing notes in terms of track and trace and testing, since, for example, Danbury, right on the New York border, maybe there's some of the infection going back and forth. Obviously, in terms of the quarantine, we work very carefully with all the regional governors because we come up with the same set of metrics, and we're trying to coordinate our enforcement so there's some consistency there. I think we're definitely benefited by working very closely with our neighbors.
I'll add. Hi, Sue. I'll add on that. I know I speak to my counterpart in New York and New Jersey at least every other day in some form, just not only catching up about what are the various steps that are happening in their state, but also coordinating our various state officials, whether it's Department of Health, Department of Education, DECD, and others. In addition, on the 7-state coordination, that is still going on, where we're able to really have a full database and understanding of what each state is doing. It's allowing us, as the governor, when we announced that 7-state partnership, was really about having a strong Northeast connection of sharing of information, ideas, and coordination. And that's a strong coordination that's still going on, and it's really showing based upon the COVID-related numbers that we are seeing, not only in testing, but also in the positivity rate in the Northeast.
Thanks for that, Paul. I was wondering also, how concerned are you, Governor, about the number of COVID cases that are cropping up at UConn? There are about 15, I think, at least so far. There are 6 football players, I think, that were announced today.
Well, they've tested thousands, and they have a positivity rate of less than 1%. I take that as pretty good news. We're watching like a hawk, as I've said before, in terms of some of those other group gatherings, be it football, practice, as you point out, where maybe there were some infections. There have been a couple of informal parties where there were gatherings there that people were not maintaining the protocols. I'm glad to see that UConn came down on them pretty hard as well. So I'm cautiously optimistic that we're going to be able to get our colleges open safely.
And one last one, please. What happens on September 9th when your public health emergency expires and if the legislature doesn't return for another special session?
That's a good question. I think they've got to come back and sometime probably early September, if I had to guess, at least for a special session, and decide what we want to do with my emergency powers. We have, as you know, 70, 80 plus executive orders, all of which would stop on September 9th, and they'd all have to be re-voted on independently. My instinct is that we'd probably ask the legislature to continue those powers a little bit longer with the necessary checks and balances, rather than put every single one of them up for a vote of the legislature, but we'll see.
And I'll add to that. If you just take into account what these emergency orders do, they're allowing our state to safely operate while we're in this time of COVID, whether it's our nursing homes, whether it's our daycares, whether it's going to be schools, whether it's the businesses and the business practices that are happening across the state. When September 9th do arrive, and if those emergency powers are not re-upped in some way, we go back to the world to how it was on March 1st, and let's be honest, it's going to be hard for us as a state to function as it was in March 1st, understanding that we're still in the world of an epidemic.
Thank you very much.
News 12 Connecticut.
Hi, Governor. Also good to see you. You look well rested from your vacation. I want to ask you about renters real quick. Your eviction freeze expires on Saturday. Are you going to extend it?
Yeah, we are. We're going to extend that out till October 1st. We still have an incredibly high unemployment rate in the state and in this country. We're also increasing the rent relief that we're going to provide for landlords so they can negotiate with the tenants there. And the rent relief is part of an overall package we've got out of our COVID relief fund. We can provide help for mortgages and other things. This can't go on forever, but it's going to go on a little bit longer. And finally, I'm really hopeful that the Senate will come together with the House of Representatives down in Washington and find some reasonable compromise going forward. And that reasonable compromise in terms of the HEROES Act and the next round of supplemental, I hope will include relief for some of our beleaguered homeowners and renters, just to give them some certainty going forward of what they can expect.
And Governor, you mentioned relief for landlords. A lot of them say they're really hurting. If I remember correctly, the 90-day grace period that you negotiated with the lenders, I think that ended July 30th, and the foreclosure ban, I think, also ended around then. So is there anything you can do on those fronts to help the landlords out?
Well, on the landlords, I mean, the rent relief is going to work with the landlords, and that's going from $10 to $20 million. And that will allow them to negotiate with a tenant who's maybe in arrears or slow in their payments to make it easier for that person to power through and reach the point where they're able to start making the full payments again on the past due rent. But what you can't have in the middle of this unemployment crisis is a lot of people being evicted and a lot of people losing their homes. So we're going to do everything we can to extend out the period of time and make it easier for people to stay in their homes. Look, I'm trying to get people back to school. I'm trying to get people back to work. And having a home that you can call your own is a really important foundation to making that happen.
Great. That's all I have. Thanks, Governor.
The Waterbury Republican American.
Thank you. I guess this is a question for the governor and the education commissioner, as well as the public health commissioner. You guys have a coded sort of county system for looking at how instruction should be provided in schools, but are there any specific state thresholds that will determine when districts need to send a student home, an entire class home, a grade or some larger segment of a school population, or entirely close a school due to the presence of COVID?
Well, I'll start with that, Paul, then Miguel can help me out. I mean, the whole foundation of our getting back to school is called the pod or cohorting, so that third grade class does not interface with all the other kids in the middle school or more broadly than that. And that means that if there is an infection detected in that third grade class, yes, that class and that teacher would quarantine for a period of time, but it wouldn't necessarily affect the entire rest of the school, for example. And I think that's really important. Scott Gottlieb described that in some detail. That's one of the questions I have about the hybrid model, Miguel, in that that third grade class, if they're only in school 2 or 3 days a week, then they're with a child care provider for 2 or 3 days a week, that doubles the nature of the cohorts they have. But I think that's going to sort itself out pretty soon. Miguel?
Yeah, sure. Thank you. So to answer the question, there are plans being developed to further provide guidance on how to close, whether it's a classroom or a school building or a wing of a building based on the spread. We have folks from our agency, superintendents, and folks from the DPH working on that this week, and we're hoping to get that out as soon as next week so that districts could have that information to go along with the metrics and some of the scenarios that we have already shared around when to isolate students and when to put students in quarantine.
Okay, and I guess this is a question for Commissioner Gifford and Josh, as well as I guess the governor. One of the findings in the mathematic report concerned the coronavirus testing policy for nursing home and staffs, nursing home residents and staff. It said that it could be missing some asymptomatic cases of COVID-19, and I believe it suggested that you guys rethink your current standard of allowing testing to be discontinued after 14 consecutive days of no new infections. And there was also, I believe they suggested you rethink another policy that does not require ongoing tests of residents or staff who have previously tested positive for COVID-19. So based on this interim report, are you going to be making any changes to your testing policies?
So I can take that, Governor, if you'd like. So we have been, even prior to receiving the Mathematica recommendation, we've been talking to our fellow states, talking to our federal partners, talking to the industry, to our long-term care ombudsman, and many other stakeholders. And many people have encouraged DPH to put in place some type of regular surveillance of staff, even when a facility has been COVID-free in both staff and residents for 14 days. Just to be clear, our guidance right now does require that both staff and residents be negative for 14 days before any suspension of testing. And so the majority of facilities are continuing to test, even if there's only one case in either staff or residents. But we have been looking at and will be rolling out some additional surveillance testing in the next several days, so that we are periodically testing staff, even in those facilities that haven't seen any COVID for a very long time.
Josh?
Nothing further to add. Deidre answered it perfectly. Thank you.
Yeah, no, I know you often have something to say on it, so I just wanted to make sure in case you did. And then just, Governor, on the FEMA plus up for the federal unemployment, for the unemployment benefits, why isn't Connecticut going with the higher $400 amount?
What the feds are going to provide, Paul, is $300. That's what they said. Connecticut provides the other $100. That's how you get to the $400 amount. So there's no disconnect there. We're going to be applying for that money right away, and we're going to be one of the first states to be able to get that plus up to folks who are unemployed in this state. Can I just say one other thing to your question about the nursing homes? I just want to give a shout out. I want to give a shout out to the frontline workers who are in those nursing homes back during the really peak of this pandemic, going in there at considerable risk, doing the right thing. They and the staff every day, working with our amazing folks at Public Health. Look, this was a fire brigade, and the place was on fire, and these were folks who were just heroes going in every day. I'd like to make that the backdrop to this Mathematica study.
Okay, and just real quick to clarify on the last question, are you saying that the state is going to, that the unemployment benefit will be $400, that'll be $300 from the federal government and another $100 from the state, or will it just be $300?
It's going to be $300 and $100 from the state. It's the $100 that we're already contributing to unemployed people, but that's the way the president and his team has defined it under the executive order. It's $300 additional dollars provided by the federal government.
Okay, thank you very much.
CT News Junkie. The Connecticut Mirror.
Hi, thanks, Max. My question is about the special session. I'm curious if the governor, if you would like to see the special session broadened to more than just the emergency orders being extended, things taken up like the eviction crisis that's potentially headed for the state, as well as the educational emergency or some of the housing reforms that people are calling for.
Paul, you're having the discussions with the leadership.
Yeah, we're still in the midst of discussions about what potential topics will be moved forward if and when the governor decides to call the legislature back into session. As we understand, the legislature has been compiling various topics from their members, but we will be having more formal conversations with them in the coming week.
Thanks. Also, I'm curious on the school closures, and some of advocates have said that it would be really helpful to have something like a civil rights dashboard to sort of track how well students are being educated or the education being offered to them, or how often they're able to show up and where there might be some gaps. Is there any consideration from the administration to have some sort of dashboard so that districts and the state is able to sort of track and how districts are doing?
Yes, I'd love to take that question. Definitely, we are planning on identifying ways to assess where students are engaging, how they're engaging, at what rate they're engaging, to make sure that we're doing our job educating children in the state of Connecticut during this pandemic. It's something that we take very seriously, and we know that while we are in different times, our responsibility remains the same. We have to educate Connecticut's children and make sure that all children in Connecticut have access to quality education.
Thanks.
Hearst, Connecticut Media.
Thanks, Max. Welcome back, Governor. I think you answered this question a little earlier, but could we go back to the nursing homes and talk about whether it was a missed opportunity by not testing widely enough and early enough in the nursing homes?
Yeah, I'll start with that, Ken, then people more knowledgeable can help out. Look, let's face it, we should have done everything earlier if we could have. You know, back in March, they were very limited in terms of the amount of testing capacity we had. And the experts were telling me the first priority has got to be folks going into the hospital, folks going into the emergency room, testing whether they are COVID or not so we knew how to allocate them going forward, testing symptomatic people going forward. We moved very early compared to our peers in terms of testing in the nursing homes as well, constrained by just the reality of the fact that early on we had to send our tests down to Atlanta. They were very limited in terms of their CDC capability. Then they allowed our own public lab to do that, and that was limited to maybe 20 or 30 a day. So we ramped up as quickly as we could given those constraints.
At this point, I mean, it is surging around the country. Are you satisfied with the amount of testing capability and PPE stockpiles going forward?
I'm pleased that we have a 90-day stockpile of everything that we need. There's no national stockpile in Washington, although I think they're building that up as well right now. In terms of our testing capacity, the country is ramping up. We've ramped up, and I think we've done a good job of working with local labs as much as we possibly can. Anytime you can control your own destiny, we've learned this the hard way, you're better off. In terms of testing, we're able to control much more of our destiny than most of our peers. That's why we're getting a faster turnaround.
And this is more of a granular question. Were DPH officials and National Guard inspectors being tested in association with their visits to nursing homes, and how often and who was paying for it?
I can take that one. No, they were not. But we are. That was one of the recommendations in the Mathematica report. We had already been putting a plan in place to do that. So our inspectors that are on site, who, by the way, were and continue to be wearing full PPE, but we acknowledge the recommendation and we'll be putting that process into place.
And Governor, it seems like there was a hockey tournament with out-of-state players at the end of July and early August. I don't know how much you know about any possible protocols or laws broken. Are you considering banning such tournaments or the inclusion of out-of-state teams?
My understanding is those teams did not come from any of those highly infected states, but I do know there are a number of infections there. We're going to take a good hard look, working with Deirdre, working with the CIAC in terms of what are the right protocols and health that we can do as we look at fall sports and then again this winter and spring.
And finally, Steve Bannon was arrested in Connecticut waters today. Are you pleased that he was apparently vacationing in Connecticut? And are you worried about whether he signed a certificate one way or the other about quarantining?
That's a good question. Did he have his 14-day quarantine? My guess is he probably did not. I think I'll leave it at that.
Is there anything that you know about his arrest that we don't know, Governor, that you could share with us?
Do you know much about the arrest?
No. We, as you can guess, it's a federal matter with federal marshals. We were not contacted beforehand. We found out in the news like everyone else. I know that the CNN put that it was on the eastern coast of Connecticut, so it was obviously written by somebody not from Connecticut. But
Yeah, Sally's not that great on the western coast of Connecticut.
Thanks a lot. Thanks, Max.
Channel 3 Eyewitness News. The Hartford Current.
Thanks, Max. First of all, Governor, the town of Mansfield has asked you to change their restrictions on gatherings to make them kind of more restrictive as UConn kids go back to campus.
Hi, good afternoon.
Request.
Recently, a coalition of immigrants protested outside your residence in Hartford demanding for financial assistance. I know over the summer you signed this multi-million-dollar relief aid to help, but they claim, the demonstrators claim, they haven't seen a cent and are actually demanding more money. Has any aid gone out to these people?
What was the first question again? I'll try and get them both.
I missed the first question because the second question came in like the Kool-Aid man.
The first question was about Mansfield. And look, the college, we are providing additional police support there to help college towns like Mansfield, Connecticut, where UConn is, help them in terms of those gatherings which you brought up, where people, can get involved in some risky behavior, not wearing the mask, and that's a concern to the community. We generally tried to steer away from having a patchwork of different restrictions, gathering sizes and such, depending, town by town. It gets complicated in terms of enforcement, but if it's not working, we'll take a second look. I think the second question involved a protest at the residence and immigrants and immigrant rights. I got to tell you, we have raised, millions of dollars, a few $1 million to be exact, in terms of rent relief, I know, for undocumented and those that need some help there. And also in terms of testing, making sure that everybody knows they can be tested. Hispanics, undocumented, know that you can be tested. We'll give you a prepaid debit card and introduce you to a doctor and get you a free test as needed. So we're aggressively trying to make sure that everybody who's part of the Connecticut population knows we're doing everything we can to take care of them in terms of public health.
For the moment, we're going to stick with the Hartford Current. The Hartford Current will be asking the next series of questions. We will get to Channel 3 Eyewitness News afterward once you are called on once again. Hartford Current.
So, Governor, just to follow up on the Mansfield thing, so do you intend to decline their request for a different restriction?
We're inclined to give them all the support they need to help better regulate what's going on there. And if they need other changes going forward, we'll take a look at that later.
Okay. I also have a question for Commissioner Gifford. I understand that you either have already met or are about to meet with the CIAC about their fall sports plans. What can you tell us about what you've heard from them and what you think will happen going forward?
You're correct. There's a meeting later on this afternoon between the team at DPH and CIAC. We have been in continuing conversation since we sent our letter last week, and they have been sharing their views. So we're having ongoing conversations to explain the position of the Department of Public Health on fall sports and to hear their comments and feedback. We've been hearing from lots of parents, of athletes, student athletes. We recognize at the Department of Public Health how important sports are to kids in high school. And we are working as hard as we can to balance the risks of the sports and the spread of COVID with those very real benefits to the physical and mental health and social well-being of those kids. And we're keeping the conversation open with CIAC.
And then one more thing on that. So youth sports have been held throughout the summer, seemingly without any huge incident. What do you see as the significant difference between youth sports and high school sports when it comes to COVID safety?
Yeah, that's a good question. So, we have said all along with our COVID recommendations at DPH that they will be fluid and adapt to the situation that we see on the ground. I think that with the fact that students are going to be gathering in large numbers in schools, which they haven't been doing over the summer, that's a consideration. The fact that we want to make sure that we keep our schools open as much as we possibly can for in-person learning and that in-person social and emotional growth, which is so important to kids of all ages. That's part of the consideration as we look at fall sports. And again, as we said, balance the risk of spread with the very real benefits of sports to kids.
Thank you.
You're welcome.
Channel 3 Eyewitness News.
I do apologize for earlier. It wasn't clear. What I was trying to say, actually, if you can hear me now, is that there were protesters demonstrating outside your residence while you were on vacation, and they were saying, this is the undocumented immigrant community, they were saying that they haven't seen a cent of that multi-million-dollar relief aid that you signed over the summer, and they're actually demanding more money. My question is, has any of that aid gone out to those people?
Yes, absolutely. I can get you the exact numbers soon, but I know that aid has gotten out to the community.
Connecticut Public Media.
All right, Max says that's a wrap. Let me just say, our state's been hit by a lot over the last 6 months, and we also look out for our fellow states. California, as you know, has got hit by a series of wildfires brought on by an incredible drought, very high-octane winds going on, and Connecticut's very own Sikorsky helicopter has been a big assist out there. Sikorsky, as you know, makes the Black Hawk helicopter with incredible lift capacity. They also have now a Firehawk helicopter. That's the same make, carries 1,000 gallons of water. So they are out there targeting, going places where the fire engines and firefighters can't go to put a line in and protect the blaze. It's an amazing chopper, the Firehawk. It drops a hose into a pool and can get 1,000 gallons of water up into the tank in less than a minute. Probably look out before you dive. But they're making an incredible difference there. I just want to give a shout out to the men and women who make the Sikorsky helicopters and the Firehawk. You're making a big difference for people on the West Coast. With that, I hope you have a good day and a safe weekend.